My name's Sharon Gurm. I'm a naturopathic physician and I specialize in integrative oncology. And now I've been in practice for 10 years. And during my practice time, I decided to pursue a fellowship in integrative oncology. And that gives me a specialty designation that allows me to provide pretty much solely naturopathic oncologic care. So I felt like if I took the path of naturopathic medicine, I would be able to offer oncologic care in a more whole person component of or platform of healthcare. After a patient underwent standard treatment, there really was no focus on how do we prevent cancer from coming back. As naturopathic doctors, we look at those individual layers. We look at things from a systems-based approach. So we evaluate, their hormones. We evaluate their digestive system. We evaluate their neurologic function. And in that framework, we also look at how they're dealing with stress. So if they're not managing stress well, there are multiple components to that. And so piece by piece, we take these things apart and we work with the patient. The first step is them feeling empowered, knowing that there is a solution to the way that they feel. They've got to be ready to do the work. They've got to commit to the plan. But if they do, within a short period of time, they start to experience the changes that are very positive and reinforcing for them. So then they want to continue with the plan to reach their optimal health or whatever their goal is for their health, and they're motivated to do that. In that framework, their stress becomes less of an issue. It becomes less of a factor, because part of the stress is just knowing, is in not knowing what is going on with me, not knowing what, why I'm dealing with this health concern, or how I can address that.
My job as a naturopathic doctor is to really provide education to patients and to teach them how to take their health back into their own hands.
When we work with patients, a big component of what we do is knowledge transfer to the patient. So as they're explaining to us what's going on and we're asking questions to further clarify what is really happening with the patient and what their needs are, they are learning in that process as we're feeding back information to them. That in and of itself gives patients a sense of empowerment. And so it's a completely different healthcare experience than what most patients are accustomed to, especially when they go to their GP. Oftentimes there isn't enough time with the GP, and so some of the knowledge transfer just isn't there. And so patients have these questions. And if you don't have your questions answered, you feel like you're not in control. You feel like this is something that you simply have to leave up to your doctor to make those decisions for you. Whereas when we're working with patients, because we take the time, we do have the time to offer to patients, they can be an integral player in what we decide to do going forward. We don't move forward unless the patient understands why we're doing what we're doing.
Naturopathic medicine is great because it integrates the whole person and the whole body and looks at different facets of people's lives and offers a lot of different treatment modalities to really find out what the cause of people's health concerns are.
What I do is not alternative medicine, so this isn't an alternate to standard conventional oncologic care, but rather it's to augment and complement the standard treatments.
My job is to guide them along that way, providing information, resources, and suggestions, and letting them be involved in the process and not just, you need to do this, this, and this, and this, because it might not work for your lifestyle. And so that's another great thing here, is that we provide individualized care. So everyone comes in, and the time that you get to spend with us is really tailored towards you specifically. So it allows you to ask any questions you may need, to have your questions answered, and to really put the power back into your hands.
Naturopathic medicine has the same philosophical concept as Chinese medicine.
An integrative medical approach involves taking conventional medicine and naturopathic medicine and bridging the gap. So essentially what we're doing is integrating these two paradigms of healthcare to create a more modern approach to healthcare, one that addresses the primary care needs of the patient, both from a diagnostic and pharmacologic perspective, but also addressing their other care needs from a more naturopathic perspective. For instance, looking at their diet and nutritional requirements or needs, looking at more of a preventative approach to healthcare. Oftentimes, patients will be going to their GP and feeling like they're just hitting a roadblock. They're not getting anywhere with their health. They're not getting the answers they need. They're not feeling well. When they come to see us, because we have access to private healthcare and private labs, we can often find the test that is required to gain that critical piece of information that helps us put the pieces of the puzzle together for the patient.